Welcome to a new episode of Forbes, where innovation meets the medicine of tomorrow. Today we explore the intersection of AI and prenatal diagnostics. Here is Nina Abid from FetalFirst, and we will be talking about his brand new platform and all it offers. Thank you, Nina, for being with us today.
Thank you so much for having me. It's such an honor to be on your stage.
Can you tell me more about the idea of FetalFirst?
Sure. I mean, FetalFirst, unfortunately came from a very tragic experience that happened personally to me. I lost my son due to a late anomaly detection.
I'm so sorry for you.
It's really, really unfortunate, but the, surprising thing is that I realized that it actually happens to a lot of parents. We don't hear about it. No one talks about it. Until it happens to someone. And when it happened to me, I realized that there is huge gaps in the prenatal care.
Yeah, we all think it's for other people, not for us.
Exactly, 100%. And then, when I had my own experience, I realized that there is this huge segmentation and gap in prenatal care. Mm-hmm. And there's also this inaccessibility for fetal medicine, which just shocked me, really. Mm-hmm. And it made my journey really, really difficult. But as a technologist myself, I build tools to make people's lives easier and to help companies make more money. I realized that I can actually build a technology to help make this situation better for parents.
Okay.
And spare the pain for parents to go through such kind of journey. And I realize I can build a technology that uses all the prenatal data to help understand.
What type of prenatal data can be uploaded to your platform?
That's a very good question. And that's actually what makes us very, very unique as FetalFirst. The kind of data that we use is everything. So we feed our AI platform every single prenatal data from, ultrasound scans, MRI images. You've got amniocentesis test results and also genomic sequencing data. Okay. As well as the whole history of the patient. So our AI model fuses all this data to have a look and understand the pregnancy from a fuller picture rather than from, one segmented side, which is actually what's going on right now. And what we have in the market currently is very segmented and is very is not connected, so to say. So the platform does that.
But how come do you pick up all this information and all this data?
So when a parent goes to their gynecologist and they realize that the parent has an anomaly, that's when the investigation starts. Okay. Some parents, unfortunately, they don't get the diagnosis. Even they don't even detect the anomaly. So parent goes on with the pregnancy, not knowing that their baby has a congenital anomaly that could change their lives. A lot of parents know that there is an anomaly, but they don't understand the severity of that anomaly. We all walk around with anomalies, but we don't know that we have them. And now that the technology is, the testing technology is improving, we are picking up more and more anomalies. Some pregnancies, unfortunately, they get terminated, and they shouldn't have been terminated. Because, and the reason is not because the doctors are not good or because, the reason I have my own experience is not because my doctor was bad or they didn't give me, the information I need, is because the system fails them, because the system doesn't give, the information.
To do maybe all the tests that we need.
Fast. That's the key. That's the key. So what FetalFirst does, using our technology, is providing parents and doctors. So the FetalFirst is not just for parents, but it's also for doctors. It gives them that bigger perspective of looking at the pregnancy as complex as it is, not just from one single point. Understand exactly the severity of the anomaly, but also predict the disability level of this anomaly for the parents to understand exactly what is it they're dealing with and what it means instead of all the jargon and the test results, it says to the parents what it means for the quality of life of their baby and their own quality of life.
But how does your AI differ from traditional prenatal analysis tools? How?
Perfect question again.
Yeah.
So what really makes our platform unique is the fact that we're able to fuse all this kind of data. Now, the data sets that we have is what makes us very unique as well. So the data sets that we currently have is collected from, Imperial College Hospital, Oxford University, in terms of like research, the NHS, which is an institution when it comes to healthcare globally. We have access to this kind of data that enables our platform to be extremely precise. So in terms of results, for example, currently we are experiencing 98.2% accuracy rate.
It's amazing.
It is. We are literally redefining, fetal healthcare.
It's a game changer.
It is a game changer, and this is just the start. This is just the beginning. We're literally just, taking off the lid of something that could be incredibly amazing and helpful. So the accuracy level that we're talking about is, it predicts or it removes the uncertainty from the game. You know exactly whether the baby has anomalies or not with that extended percentage. Now, working together with the NHS and the Imperial Hospital and getting more and more good data, our goal is to achieve 99%, and we are on the way of doing that.
My next question is how do you ensure data privacy and security for such sensitive health information?
Absolutely.
It's so sensitive. I mean,
yeah. I mean, healthcare in general data in healthcare is very sacred. Now, it's even more sacred when it comes to unborn children.
Yeah.
And that's very, very, sensitive line that we understand. So at the core of our business is the security and safety of this data. First of all, the kind of, security system that we have is so strong that we're able to access NHS data. NHS, has very strict guidelines that we adhere to. In terms of like data storage, we don't store the client's data. So all the, let's say, personal data, all the personal indications are stripped out of the data. So the data that we have has no information about the patient themselves. So there's no risk of it to being, even if, let's say, there is a risk, which there isn't, because we are trying, we're doing all we can. We're literally
all the security.
We use, end-to-end encryption. We are GDPR compliant, and we also use, Azure's Vault, Key Vault, which is just the next level of security when it comes to when it comes to
it sounds absolutely safe.
Look, it is safe by the standards that we have currently, but our goal is not to just sit there. Our goal is to make it absolutely safe and strip out all the personal data, not to share the information of the people themselves.
Everybody.
Exactly. It's not about that, but it's also, when it comes to security, it's not about just the technology itself. When it comes to security, we're talking about building or having that trust. I mean, these parents are entrusting us with the most vulnerable information that they have.
Yeah, sure.
And we understand that. That's a very big responsibility, and we appreciate that and make sure that that trust is always there.
We spoke about parents, but who is FetalFirst mainly designed for? Parents, professional, boss, doctor?
Well, FetalFirst is not just for parents. It provides value for both ends of the care equation. So for parents, it provides the information, the analysis in the language they understand, but also it provides psychological and emotional support through our forums and also through our informed therapy. We have therapists on board that are informed with this specific situation. And But also we provide logistical support for parents, because there are, for example, some countries where parents are not able to make choices. They don't have choices. Either the government makes choices, or the government, tradition sometimes, or even religion makes it even difficult for those parents to make decisions. But when in areas where law prohibits parents from making those decisions, we're offering and giving a hand by giving them all the logistical support to be able to make those decisions. So we are giving the power of decision making back to the hands of the parents. And in terms of doctors, we are providing diagnosis support through our AI, and also telehealth, secure telehealth platform where they can connect with the patient. So what we're essentially creating here is we're creating more of like less confusion and less ambiguity and more collaboration between the patient and the doctor, because both of them, they're using the same system, and both of them have access to the information they need to be able to make decisions.
What impact has FetalFirst already had in your pilot studies or clinical trials?
You heard it first from here, because this is literally the first time that we are going to be talking about it. Currently, we have achieved 20% reduction in misdiagnosis. A lot of, unfortunately, anomalies, they go undiagnosed. And from our pilot trial, we have noticed 20% reduction in misdiagnosis, and this is in a very short period of time. So this has just happened in the past few months. So now that we are building more and more relationships with fetal medicine centers, we're going to be seeing this number increasing. Yeah.
And how accurate are your assessments in detecting fetal anomalies?
The accuracy is currently at, like I said earlier, 98.2%, which is negative predictive percentage, which means we are extremely reliable in when it comes to ruling out fetal anomalies, which is incredibly important for parents, because then it takes away all that stress and anxiety. And we're looking at increasing it to 99% now that we are establishing relationships with and partnerships with, Oxford University, NHS, Imperial Hospital, UCL. Currently, we have someone who's extremely important in genetics, Dr. Gudrun Moore. She's a pioneer, world renowned, and she joined she joined our board as an advisor. And through her, of course, we're going to be able to, get even better and better in terms of our accuracy. Right? Yeah.
What would you say to a future parents who is hesitant to use AI in such a sensitive area?
I completely understand people feeling hesitant. It's completely understandable. But what I want to say
everything is new. The AI is new as well.
100%. So especially in such a sensitive subject and matter. But what I want to say here is that AI is not here to replace the human expertise.
Yeah.
AI is here to ensure that the human expertise has enough information and enough deep analysis to understand exactly what kind of situation they're dealing with to improve their judgments. So we're here, not to replace human,
but to help.
But to help and even make, the capacity of our human doctors much stronger and more empowering, especially for gynecologists. They don't necessarily have the fetal medicine, expertise, but then we're making fetal medicine, world-class fetal medicine, accessible to everyone, and literally democratizing it to all parents worldwide. Now that we are building our relationships with, for example, the UAE healthcare system, we're bridging those borders where governments were resistant. Now we are bridging those governmental borders. Governments are seeing the value that such products is bringing in, and more governments are coming in. We're talking about lots of countries here in Europe, France included, and the UAE and Middle East in general. And you will be hearing definitely more, partnerships to come in. because they see the value. Yeah.
Thank you so much, Nina, for sharing with us all this sensitive experience and for today's conversation. Very interesting.
Thank you very much for having me. Appreciate it.